Here's my favorite excerpts from the study or systematic review of migraines and magnesium. Now let's read through this one excerpt to give you a highlight of how effective magnesium is, in this case an ideal situation intravenously, at relieving the pain from migraine. Proceed as follows. Most studies show that magnesium may have significant therapeutic potential for acute migraine relief. One of the first studies conducted found that 80% of patients who received 1 gram of intravenous magnesium were pain-free. We're not talking reduced pain, pain-free within 15 minutes of infusion. That just gives you an idea of an ideal situation of how effective magnesium is in addressing the challenges of migraine relief. Now let's go right into the study itself. I should say review of the studies, which is quite intriguing. I'm going to read kind of fast, a lot of territory to cover, but wow, is it fascinating. To proceed, migraine is among the 10 neurological conditions accounting for the greatest disability in the whole population. This I did not know. The leading cause of disability of children and adolescents aged 5 to 19. And the second cause of disability for adults aged 20 to 59. Magnesium deficiency is also a very common condition resulting from diverse reasons, including insufficient dietary consumption, increased loss through gastrointestinal or renal systems. Accumulating evidence for case reports and case control studies, observational studies, and randomized placebo-controlled trials has shown the effectiveness of magnesium supplementation in alleviating migraine both acutely and chronically. This article aims to provide a comprehensive review of the available evidence on the links between magnesium and migraine, considering the role of magnesium in pathogenesis of migraine and the utility of magnesium in its prevention and treatment. A brief example, if you want to pause it, this one covers a lot of the oral consumption of magnesium. Again, a lot of different methods of administration, but this one's the oral one, to hold and pause per se, if you want to review. There it is, but that's just a brief, small amount of the studies that they actually did review. Now, the highlights, we're going to go through a huge study, but let's take the important tidbits out. Chronic deficiency of magnesium is common, in particular among older adults. However, insufficient magnesium intake extends to all ages, estimated that half of the U.S. population has inadequate dietary magnesium. Magnesium deficiency can be attributed to several factors, such as low dietary magnesium intake, which is typical of Western diets, increased urinary excretion, increased loss through the gastrointestinal tract, or reduced intestinal absorption due to various pathologicals or ionotropic conditions. The normal serum magnesium concentrations in adults, if you should know, is 1.7 milligrams a deciliter to 2.4 milligrams a deciliter, which hypomagnesia begins at that 1.7 range. Now, examples of issues that can present challenges to magnesium intake or maintenance of magnesium, whether intracellular or serum, is as follows. You see the 4 categories. A lot of people fit into one of those 4. But again, to proceed, review, pause. Let's go ahead. A study utilizing magnesium load test revealed increased magnesium retention in migraine sufferers. These are the highlights. Please forgive me. Compared to healthy controls, suggesting a systematic magnesium deficiency linked to migraine. Additionally, a 2-week trial showed that when migraine patients consume mineral water, just mineral water, with 110 milligrams a liter of magnesium daily, their intracellular erythrocyte magnesium concentration significantly increased compared to those healthy controls. So they're noticing an increased magnesium retention in migraine sufferers. So there's a play there, a correlation of some sort. To proceed forward, I don't want to add publisher bias. A study found, listen to this highlight, a study found that low serum magnesium levels caused a 35-fold increase in the likelihood of acute headaches in migraine patients. That's pretty astounding. In a double-blind, crossover, randomized controlled trial, administered 63 patients who were administered 500 milligrams of magnesium oxide, and not a magnesium oxide fan, but still just the same, don't want to have publisher bias, followed by 800 milligrams of valproate sodium or vice versa for a duration of 24 weeks. The results revealed that the frequency and average duration of migraine attacks were similar in both groups, suggesting that magnesium oxide is as effective as valproate in preventing migraines without causing significant adverse effects. The caveat there, keep in mind, this is 24 weeks, so it may take some time. Into the absorption. Magnesium is mainly absorbed in the small intestine, especially in the distal jejunum or ileum, with minimal transcellular absorption in the colon. Absorption begins about 1 hour after ingestion, reaching about 80% after 6 hours. Magnesium chelated with amino acids like magnesium glycinate, one of my favorites, is absorbed via the ditriptide transporter pathway. Absorption is influenced by factors such as magnesium levels, age, dose, food, magnesium complex type, and formulation. Higher doses on an empty stomach increase absorption, something which I was not aware of. Empty stomach. To conclude, while the current data support the benefits of both intravenous and oral magnesium administration for the management of acute migraine episodes requiring immediate treatment, as well as in the prevention of migraine, larger randomized controlled trials are needed to further validate the effectiveness of magnesium as a treatment option. Although these trials are needed, considering the evidence, and from the last decades, magnesium could be included in guidelines and protocols for the treatment of both acute and chronic migraine, as indicated by the studies included in this review, i.e., attention medical practitioners. Magnesium supplementation could be considered as an add-on therapy when other treatments are minimally effective. Additionally, therapeutic trials with magnesium should be followed, if necessary, by other established and new treatments is also possible. All right. Thus, oral magnesium supplements are a cost-effective and well-tolerated option for treating migraine patients, alone or in combination with other compounds, which may indeed help decrease the frequency of attacks, lower treatment costs, and minimize the risk of severe side effects, which is quite amazing. We go back to that 24-week study highlight, which I brought up. The magnesium in combination or in comparison with valproate having similar effects was quite amazing. So, medical practitioners, be aware. Again, incredible review. I love the many studies that were covered, both intravenous and orally, as far as giving an idea of the gravity of importance of magnesium in playing a role at alleviating the many challenges associated with migraine. Again, gratitude to the researcher. I am humble you watch, and look forward to see what you and I both share next week. All right, catch you all next time. See you then. Bye.